Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 35, Natrum MUR 1. Full name Natrum muriaticum. Chemical name sodium chloride, common salt. Mode of action. Among all inorganic salts present in our body, amount of sodium chloride is second highest. We know in different time, depending on the age and sex, water content in our body as per weight remains between 45 to 75%. This salt is produced in the cells by physiological process. So osmotic pressure in the cells increases. As a result, water from intercellular space enter into the cells and perform necessary physiological processes. If this salt is not produced in the salt of an individual, in the cells of an individual, water accumulates in the intercellular space and it gets swollen up. Then water becomes excess in eyes, nose, mouth and other organs of that individual. Craving for salt is increased. But salt taken with foods and drinks is in crude state, so it cannot enter the cells. Ultimately, amount of salt is increased in the cellular space. Different unusual sign symptoms appear in the body of the individual. Sum total of these sign symptoms of deficiency are actually sign symptoms of deficiency of Natrum MUR in the body. Natrum MUR for mental symptoms: hopeless, effortless about future, like to stay alone, morose, feel irritated if consoled, loss of memory, weep easily, suffer from depression, yet like to ponder over unpleasant depressive subjects, think over past matters, abnormal anxiety over imaginary disease for days together, along with constipation. Ladies sometimes get excited, sometimes dance around like girls, irritable, fly into anger easily, burst into emotion, martyr in themselves. Depression of teenage, devastated mentally, little mental labor brings too much weariness, illness due to failure in love, very sad during menstrual period, especially in morning, hysteria. The pictures in the bottom are relevant to this description above. Just correlate, please. Natrum MUR for head and scalp symptoms. Natrum MUR can manage different types of headache. Number one, congestive type affects forehead, both temple, semilateral. What's in the morning, relief from sleep, often associated with menstrual period. Number two, dull, heavy headache with profuse tears, drowsiness, unrefreshing sleep. Headache with constipation owing to dryness of the mucosa of intestinal tract. Tongue clear but full of bubbles of saliva. Vomiting of transparent flames or simple water. Hemicrania leading to fainting with spasms of limb. Hammering headache, worse in the morning. Headache of schoolgirls during menses with burning on vertex. Itching eruption on margin of hair at the nape of the neck with glutinous fluid. Dandruff, hair fall, watering from mouth, nose and eyes. Here a particular technical term has been used, is the nape of the neck. The nape of the neck means actually this region where the margin of hair meets the neck, that is called nape of the neck. All other things just description described above, the images have been shown below. Natrum MUR for eye symptoms: dim vision, white spots and blisters on the cornea. White spot blisters on the cornea. Photophobia of tubercular subject owing to ulcers on cornea. Discharge of clear mucus or tears from eyes for obstruction of tear ducts. Note this thing. This is the tear duct. The tear duct is connected to the corner of the eye with the canaliculi. So, by which this water from eyes come into the nasal passage and gradually evaporated. That's why when we weeps too much, there is water coming through the nostrils, because this water, excess water passes. This is the passage through tear duct. Periodical neuralgic pain in eyes with flow of tear and reddened conjunctiva. Trouble with vitreous humor. This is vitreous humor, the second chamber of the eye. Eye has got two chambers. First chamber, front chamber in front of the lens, posterior chamber behind the lens. This is filled up with vitreous humor. PVT, that is posterior vitreous attachment, a type of serious disease with sparkle of light along the border of vision field during reading feeling as if letters are running, dryness of eyelids, itching, burning as if pricking of pains, edges red. These are the symptoms of posterior vitreous detachment. That is the picture is this, and this is normal eye, and this is blepharitis. Blepharitis means actually the inflammation of the edges of the lids. That will be coming later on possibly. Two dot means continuing. Along eyelids granulation. There may be tears or not. Lid swollen becomes very red. Gritty sensation, burning, blepharitis. That particular I have already told in the last frame. Conjunctivitis with watery mucus, acid, acrid tears, photophobia. For asthenia, eye strain due to prolonged use of eye. This is called asthenia. Prolonged use of eye. Someone is in front of laptop or anything else, sitting or doing work for say at a stretch 6 hours, 7 hours, 8 hours. Then asthenopia comes, and there is no better remedy than Natrum mur in these cases. This has been uttered by Dr. Dewey and Dr. Boericke in their famous book. So please remind this. If 1 or 2 doses of Natrum, say 12x or 30x, will immediately resolve the case. Opacity of lens. Opacity lens means cataract. Chief remedy is CP, that is calcium phos, to stop cataract formation. You have to stop cataract formation, give CP. CF, that is calcium fluorogam, for hard cataract. Calimure for soft cataract and cataract due to injury. Silicea for cataract due to suppression of food fluid. So many particular situations are there where particular salt is very important. Please remember this thing. And the pictures has been shown here. This is blepharitis, this is conjunctivitis, this is asthenopia, and this is cataract in eye and normal eye. In normal eye, you see this the dark black ring. This is iris. Through iris, you will look into the directly into the lens, and this lens has been fibrosed, that cataract formation. So it is seen as a gray matter. Natrum mur for ear symptom. Deafness due to inflammation and swelling of tympanic cavity and eustachian tube. Calisalp and calimure also cover this symptom. Roaring in ears, acrid oozing from ear, cracking sound in ear during chewing, itching, burning and stitching pain in ears. This is tympanic cavity. This second middle layer or ear has got 3 parts, outer ear, middle ear, inner ear. So this is middle ear. Middle ear, we have got 3 small bones here, malleus, incus and stapes. This cavity, then it is eustachian tube. Through this tube, this middle ear is connected to throat, and this is internal ear. Natrum mur nose symptoms. Due to chronic inflammation of nose and pharynx, subjects are devoid of sense of smell and tastes. Influenza and hay fever. Chronic colds of anemic patient. Mucus from nose tasted salty. Secretion of transparent water-like phlegm. Dryness of posterior nares. What is posterior nares? This is the posterior. This is nose. This is anterior opening. It is called anterior nare. The nose is open in the back portion also towards throats. This is called posterior nare. So dryness of posterior nare, sneezing over and over, epistaxis with cough or when head placed low. This is epistaxis. Continuation from previous layer, all inflammation worse in the morning. One side of nose numb, catching of old cold, starts in sneezing, water-like secretion from nose, again very dry nose with soreness as if blocked. Secretion like egg albumin may occur in one side too. Natrum mur for facial symptoms, morose, pale face. Morose, pale face, not the face. Facial pains with characteristic tongue. Characteristic tongue means Natrum mur has got 2 types of characteristics. One is bubbles, salivary bubbles over the tongue. Another is map tongue. Vomiting of clear water, skin oily, sweat face in during eating, much itching in moustache, hair drops off from moustache, water blister on moustache, and pustules on forehead. Natrum mur for mouth symptoms. Profuse secretion of salty saliva, pearl-like blisters around mouth, moist ulcer at the angle of mouth, thrush in tongue, cracks in lips, burning pains, uvula elongated, follicular inflammation in pharynx, swelling of lips, eruption on chin. Natrum for tongue symptoms: tongue gluey, wet, clean, small bubbles of saliva on the edges, at the tip blisters, map tongue, sensation as if hair were attached to tongue. Natrum for tooth symptoms: ulcers in gum, bleed easily, sore, with toothache, salivation or discharge of tears involuntarily, loose teeth. Ranula, actually a technical term. This is ranula. It's some sort of soft cystic-like swelling under the tongue. Chronic inflammation of salivary glands, salivation during teething, gum balls with throbbing, dull pain. Life case: Miss Porinita Das, aged 19 years, a student of MA, came to my chamber with her mother. Mother reported for last 6 months Porinita was morose, could not mind her study, duty, and even food, drinks, etc. Used to spend time mostly in bed, and when awoken, looked outside through windows beside her reading table unmindfully. When questioned, there was no reply. Even when she caressed her affectionately, that is a mother, caressed her affectionately, she gestured negatively. I looked at the face of the Purita and found a lady highly depressed in her. From questioning mother in low tone, it was gathered that there was an incident of disappointment of love. Moreover, she used to take extra salt while taking food these days, which was contrary to her habits. I prescribed NM, Natrum, 200x, a dose a week for 4 weeks and to report thereafter. After 3 weeks, her mother reported that Purnita had regained her older status, going to college as usual, getting bath, taking foods, performing duties as before. She inquired of me whether the last dose needed to be given. I instructed to take it as per old suggestions. See, this is a very simple case, but to start with, one would wonder how this situation is transformed in normalcy with the just help of few doses of Natrum 200x. Actually, Natrum 200x, Natrum is a medicine of that type. Thanks for listening and view. If any difficulties here, please write down in the comment section. I will certainly respond.